Hello lovely, it's your girl Nancy, and I'm back again with another video. Now this video we are going to talk about lymphedema. What is lymphedema? How does lymphedema happen? And what can we do about lymphedema as far as occupational therapy goes? In order to understand what lymphedema is and the anatomy behind lymphedema, I wanted us to talk a little bit about the lymphatic system. The lymphatic system is part of your immune system. The whole purpose of the lymphatic system is to move fluid called the lymph fluid through the body, up into the bloodstream and into the heart. The lymph fluid consists of oxygen and nutrients and fats and hormones, and also gets rid of extra fluid the body does not need. It can also get rid of infections and cancerous cells in the body you do not necessarily need. So how does this work? So the lymph fluid moves through the body in an upward motion, so it only moves in one direction, up. Okay, now as the lymph fluid is moving through the body, it stops at what I would like to call like rest stops or toll booths, so to speak. All the lymph fluids before it gets to the heart must stop at the lymph nodes. Lymph nodes are located in your groin area, your armpit, and your neck. And each time the fluid gets to the lymph nodes, the fluid gets filtered. And it gets filtered because we don't want to send bad fluid to the heart. The job of the lymph nodes is to filter the lymph fluid to get rid of any kind of cancer or bacteria that is not needed. Within these lymph nodes are also protein-rich white blood cells, which, as you know, white blood cells are part of your immune system, and their job is to get rid of bad cells and bad bacteria and infections and stuff like that. So it makes sense that the lymph fluids get filtered in the lymph nodes. Now, how does this fluid even move up through the body into the bloodstream and into the heart? By muscle contractions. Yes, you heard that right. So each time that your muscle moves, that your muscle contract, the fluid are able to move up towards where it's supposed to go, up in the bloodstream and into the heart. Now, for any reason at all, if this fluid is not able to move how it's supposed to move in the speed that it's supposed to move, then there is an accumulation of fluid in a particular section. Okay, and that's basically how edema and swelling occurs. There's just an accumulation of this lymph fluid that's not able to drain and move up to where it's supposed to go, so it gets stuck. When you think about like fluid getting accumulated because of a block or because the fluid can't flow properly because of whatever reason, think of when your sink get clogged. Okay, when your sink get clogged and you put water in your sink, the water is not able to go through the drain because there's something in the drain that is clogging up the drain, and so the water is not able to go through it. It's the same idea. So there's an accumulation of water in the sink. It's the same thing that happens in the body. The fluid is not able to move up to where it needs to go, so what is it going to do? It's going to accumulate in the most dependent position, which is usually the leg and the arms. Okay, whenever there's swelling in any particular part of the body, it's important that you get rid of the swelling as soon as possible. And the reason why is because if you don't get rid of the swelling with like an antibiotic, for example, what happens is that the swelling, which is a fluid, we have to remember the fluid contains nutrients and sometimes even bacteria and stuff like that, proteins and oxygen and fats and hormones. And so sometimes bacteria get attracted to these nutrients in the fluid or the proteins in the fluid, and it starts to turn into, it goes from a fluid into more like a hard gel kind of consistency. At this point, you have to start worrying about cellulitis, and you do not want cellulitis or fibrosis. Cellulitis is when the skin tissue get infected and the fluid turns into like a hard gel, and then fibrosis is the hardening of the skin tissue. You don't want either one of these because what happens is that you cannot reverse these type of symptoms. So it's paramount that if you think that you have any kind of lymphedema or edema, that you get rid of it as soon as possible. So what causes lymphedema? Lymphedema can be a congenital thing, which means that you are born with a faulty lymphatic system. Okay, so your body is not able to move the fluid as it's supposed to, or move it as properly or as fast as it's supposed to move it, like somebody who has a normal lymphatic system. That's number one. Number two, if you have cancer, especially breast cancer, what happens is that because the breast is so close to the armpit, there's lymph nodes under your armpit. When you get radiation, what happens is that radiation affects or damages the lymphatic system or the lymph nodes. And so the fluid is not able to move up how it's supposed to move. And so because of that, you can get lymphedema in that way. Another way you can get lymphedema, usually when you get involved in any kind of surgery or accidents, you can damage your lymphatic system in that way. Another way is infections. Any kind of infection can affect your lymphatic system, okay, your white blood cells, and you can get lymphedema that way. Chronic venous insufficiency, which basically means that fluid is not able to move as sufficient as it's supposed to move throughout the body, which can cause an accumulation of fluid in one specific part of the body. Another one, and a big one, is definitely age. The older you get, the less your body is able to move things how it's supposed to move it. Everything kind of slows down. Nothing anybody can do about it. Right? So that's why it's so important that we move even more as we get older, because our systems and the things that is supposed to, it's kind of like when you drive a car and you have this car for years and years and years and years. The older the car gets, the more issues that the car is going to start having, and you're going to need some tuning up, and you're going to need to start repairing things and replacing things. It's the same thing with aging. The older you get, the slower your body systems get, and so you're more accessible to getting things like lymphedema. There's someone who is not as active. Okay, so if you pair up age with not being active, or even just not being active in general, and you have a very sedentary lifestyle and your lymph fluids are not able to move how they're supposed to move, you can get lymphedema that way as well. So movement, any kind of movement, is very, very important. So what can we do? What can OT do? What help can you get if you already have lymphedema? Number one, I would suggest that you contact your medical doctor as soon as possible, because you want to make sure that this is the early stages and they can still give you antibiotic to prevent cellulitis and fibrosis from forming. Okay, that's number one. Number two is to contact your occupational therapist or any kind of therapist who have a certification in lymphedema therapy, which basically means that they have went through some extensive certification in learning how to drain the edema or the lymph fluid from the body in a certain way. There's different ways that they are able to do this. Another thing that occupational therapists can do is to come up with home exercise programs. Home exercise programs to allow you to start performing different type of exercises to allow the fluid to start moving. The more your body moves, your extremities are moving, your arms, your legs, and your whole body is moving, the more muscle contraction, the more the fluid is able to move up and move to where it's supposed to go. Another thing that can help is compression garments. Compression garments are so important if you have any kind of edema. Compression garments, compression sleeves, compression gloves, anything like that. And occupational therapists are well trained in giving you the type of compression that you need depending on your edema and depending on how severe it is. They can measure you and they can recommend the best compression garment for your particular issue. Another thing that you can do for someone with lymphedema is to educate them. A lot of people are not able to take care of their symptoms that they have or the diagnosis that they have because they don't really have the education that they need on that particular symptom. So the more you educate your patient about what it is and what you can do about it, the more motivated they become to get better. Because if I have lymphedema and I don't know the first thing about what it is and how severe it is and how it can impact my lifestyle and can impact the things that I do, then I'm not really going to take it that serious. But if I know the anatomy behind it and the disadvantages behind it, cons behind it, and how bad it can get with cellulitis and fibrosis, infections of your skin and permanent infections of your skin, permanent hardening of your skin, maybe that person will be more inclined to do something about it. Elevation is huge in any kind of edema. Whenever I have a patient who has any kind of edema, the first thing that I always tell them is to elevate that extremity, whether it be in the arms or the legs, to elevate them. Whether you're in bed or you're sitting up, to elevate them, okay? Usually they say to elevate it above the heart, but any kind of elevation is good. You can get the fluid to kind of flow back to where it needs to go. Now, the other tips that I have for if you have lymphedema is herbal teas. Yes, herbal teas are known, and there's a lot of research on this, that ginger tea, which I love ginger tea. I drink ginger tea. I cook with ginger. I eat ginger. I love ginger. Ginger actually has anti-inflammatory properties in it, and this makes it amazing for people who have lymphedema. Another tea to check out is rose hip tea, and the last tea is calendula tea. Okay, these three teas are known to be really, really good in getting rid of lymphedema. The last but not the least tip on how to get rid of lymphedema is to drink lots and lots and lots and lots of water, okay? Water is really, really good for your body in general, right? I feel like that's like the cure for every disease on the planet, is to drink water. And you're probably thinking like, why should I be drinking more water when I'm already filled with fluid? Why am I drinking more fluid? Like, it doesn't make any sense. But it makes a lot of sense, because what do you do when you drink a lot of water? You pee. So the more you pee, the more you get rid of the unwanted bacteria in the body and hormones and over excessive fluid in your body. You get rid of all those infections, which is good, because the more the infections stay in your body, the more likely you are to develop cellulitis and fibrosis. So by drinking a lot of water, you get rid of the infections that's starting to form in the body. So water, water, water. Drink as much water as you possibly can, and you should be just fine. Okay, so I think that's basically it. Thank you guys so much for watching my channel. As always, I love you guys so, so much. Follow me on Facebook, on Instagram. Make sure you like, comment, and subscribe, and I will see you next week. Bye.